but there's also something called the Retinoid Uglies, the most controversial skincare ingredient. Always remember that retinols require daily use, which that last part is probably the most important and the most controversial skincare ingredient. Well, maybe second most, but one of the most highly debatable ones is retinoids. And should you be using this on your skin, or is it destroying your skin? Let's get into everything retinoids, what you should be doing, how to use them, if you're a good candidate, and what benefit it's going to give you. And if you like this kind of content, skincare, facial plastics, aesthetics, don't forget to like and follow and subscribe for more. So the broad category of retinoids are vitamin A derivatives. These are well-studied ingredients in skincare, known to do quite a few things for your skin. It's sort of like the jack of all trades. It improves the appearance of fine lines and wrinkles. It's used to treat acne. It can help with hyperpigmentation. In my experience, we can get into that. It does require a bit more, but it can help with hyperpigmentation. It builds collagen, but it also prevents collagen breakdown, which that last part is probably the most important and the least talked about, is that you want to keep the collagen you have, right? The retinoids are going to allow you to do that. But because retinoids can be irritating to the skin and they help turn the skin over a lot, people have trouble using them. They don't know which ones to use. It's hard to know whether you should be using a prescription retinoid or a retinoid that you can find at the supermarket. And so let's get into the best, the worst, the not so well studied, and the well studied. The most active form of a retinoid is tretinoin or tazarotene. These are vitamin A derivatives in their most active form, meaning you need a prescription to get them. And there are lots of ways you can get a prescription, for example, by going online, but they do require a prescription or going into a doctor's office or a med spa. These tend to turn over your cells quite quickly. There's multiple strengths. There's 0.25 for 0.025 for tretinoin, 0.05, and 0.1%. Most patients start off at the 0.025 or the 0.05. But these medications are drugs, meaning that they have specific claims that you can make by the FDA, and they are not cosmetic retinols. These are prescription medications. The best way for people to use these types of products is in conjunction with a comprehensive skincare routine, including sunscreen and then other ingredients as well. And the thing about tretinoin is that bigger and badder doesn't mean better for your skin, right? It's the most active form and it's a prescription. So patients tend to gravitate towards that one more. And even though it's a prescription, it tends to be cheaper in price than a lot of cosmetic retinols, which again is a great idea. But if your skin is sensitive, if you are prone to redness, some people just can't tolerate it, then tretinoin might not be for you. It is my favorite. Most of my patients are on tretinoin. I've been using 0.1% tretinoin for maybe 5+ years now, and I attribute a lot of my improvement in my skin to tretinoin. But remember, it does need to be used as part of a comprehensive skincare routine, which includes sunscreen. So what is tretinoin doing that other ingredients aren't doing, other retinols aren't doing? Well, it's hard to know because other retinols are now considered in a different category. Retinol and retinal and other types of those ingredients, retinoids, are considered cosmetic retinols. So it is hard to compare a retinol to a tretinoin with respect to some of the efficacy, because now you're talking about things that are in brands like SkinCeuticals or Drunk Elephant, or now is not necessarily gone through the same rigorous testing that the FDA requires for drug claims. So you might notice on tretinoin that it has an indication to treat acne, to prevent acne, to treat sun-damaged skin. Those claims cannot be made by cosmetic products. Cosmetic products improve the appearance of fine lines, they improve the appearance of acne scars, etc. They cannot be claimed to be, making drug claims, which, doesn't necessarily mean that they don't improve the appearance of those things. These are still vitamin A derivatives. But now we're going to move over to talk about retinal and retinol. Both of those are converted into the most active form, tretinoin or retinoic acid. But because they require a few steps to be converted, they're considered cosmetic retinoids, and they don't require FDA testing, and they don't irritate the skin generally as much as the most active form. So the thing that you got to think about is which one are you going to use more consistently? If you can use a retinol or a retinal more consistently than tretinoin, your skin is going to have a better outcome than you using tretinoin every other day. So what's a good example of a retinol I like? I like the Alpha Ret Overnight Cream by Skin Better. I also like some over-the-counter ones like Rock Retinol. These provide gentle emollients, gentle exfoliants in their products to minimize that irritation. But always remember that retinols require daily use. This is not a product that you're going to use for 1 or 2 months. You're going to want to use this every single day, at least 6 nights a week, in my opinion. You can start off slow, start off 2 to 3 days a week, and then increase every few weeks. But 6 nights a week is where most of the data for these preventative things like pigmentation, fine lines, wrinkles, and acne really lie. So what do you have to watch out for? So retinoids tend to irritate the skin, but there's also something called the retinoid uglies. You know, when you get this dry, peely, or purge skin where a lot of acne is coming to the surface. There's some controversy around whether your skin actually purges, but the thing to remember is that dryness and redness can be normal. If you use emollients and moisturizers on the skin before and after your retinol, it can help mitigate that issue, but it is normal in the beginning to have somewhat of we don't call it an adverse reaction, we call it an expected reaction. You're going to have some potential irritation from it. Some patients won't experience that. Ways to minimize that is also to use the appropriate amount. You don't want to use it starting off on wet skin. Some patients can use it on wet skin, no problem, but most patients tolerate it when they're first starting on dry skin because wet skin will absorb more of the product. You want to use a small amount, like a pea or pearl size amount for the full face, and then minimize it on the neck and chest. You can use it there too, but those are more sensitive areas. Things to watch out for with retinoids. So if your skin is constantly red and peeling for months and months and months, if you have rosacea, extremely sensitive skin, then you want to be very careful with retinoids because it can further irritate your skin. And if you have melasma and you're using a retinoid that is overly irritating your skin, your melasma or hyperpigmentation could actually get worse in the interim. So you do have to be careful, and always, again, remember these are medications, specifically tretinoin. You want to be under the care of a physician or some expert that knows how to take care of this if you run into an issue. The time to use tretinoin is at night. So you are going to be repairing your skin at night. So you cleanse your face at night, get all the sunscreen off, put your pea size of retinoid or tretinoin on your skin, full face. It'll get to where it needs to get to, and then follow it up with the moisturizer or other skincare products. You can lock it in with Vaseline. All the people that tell you that you can't do that, they don't know what they're talking about. It's fine to do that. But usually use it at night. There are some really nice formulated retinols that can be used twice a day. I use the Beauty of Joseon Retinal eye cream under my eyes in the morning and the evening. It's perfectly fine to do that, and it's safe to do that. It has been tested and it is stable to do that. Tretinoin, though, I would not use during the day. I don't see the benefit for doing that. So hopefully this answered your questions about retinoids and why they are so controversial, and they can be great or bad or problematic for some people. But remember, go to an expert, get your questions answered, and then we will help guide you in what products are going to work best for your skin. Don't forget to like, follow, and subscribe. See you next time.